1. Tuberculosis treatment. Tuberculosis, TB, treatment involves a combination of antibiotics taken over a prolonged period to ensure the complete eradication of the Mycobacterium tuberculosis bacteria from the body. The standard treatment regimen for active TB typically lasts 6 months and includes several phases. Standard treatment regimen. Initial phase: for the first 2 months, patients take 4 drugs: isoniazid, INH, rifampin, RIF, pyrazinamide, PZA, and ethambutol, EMB. This phase aims to kill most of the bacteria quickly. Continuation phase: for the next 4 months, the treatment continues with 2 drugs, isoniazid and rifampin. This phase ensures the remaining bacteria are eliminated. Multidrug-resistant TB, MDR-TB. MDR-TB treatment requires a longer treatment duration, up to 20 months or more, and the use of second-line drugs, which may have more severe side effects. Medications can include fluoroquinolones and injectable antibiotics like amikacin, kanamycin, or capreomycin. Adherence to treatment. Directly observed therapy, DOT. Health professionals supervise the intake of medications to ensure compliance and reduce the risk of resistance. Side effects monitoring. Regular checkups are essential to manage and monitor potential side effects, including liver toxicity and peripheral neuropathy. Number 2. Tuberculosis prevention. Preventing the spread of tuberculosis involves a combination of public health strategies, vaccination, and individual precautions. Vaccination. BCG vaccine. The Bacillus calmette-guerin (BCG) vaccine is widely used in countries with high TB prevalence. It is most effective in preventing severe forms of TB, such as TB meningitis in children. Public health measures. Screening and testing. Regular screening of high-risk populations, including healthcare workers, people with HIV, and those in close contact with TB patients. Isolation of active TB cases. To prevent transmission, patients with active TB are often isolated until they are no longer contagious. Treatment of latent TB infection, LTBI. People with latent TB infection, especially those at high risk of developing active TB, may receive treatment to prevent activation of the disease. Personal precautions. Good ventilation, ensuring adequate ventilation in living spaces to reduce the concentration of airborne TB bacteria. Respiratory hygiene, covering the mouth when coughing or sneezing and wearing masks to prevent the spread of bacteria. 3. Tuberculosis causes. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis, which primarily affects the lungs but can also infect other parts of the body, such as the kidneys, spine, and brain. Transmission. Airborne transmission. TB bacteria are spread through the air when a person with active TB disease of the lungs or throat coughs, sneezes, speaks, or sings. People nearby may inhale the bacteria and become infected. Close contact. Prolonged or frequent exposure to an infected individual increases the risk of transmission, particularly in crowded or poorly ventilated environments. Risk factors. Weakened immune system. Conditions such as HIV/AIDS, diabetes, and certain cancers can compromise the immune system, making individuals more susceptible to TB. Malnutrition and substance abuse. Poor nutrition and substance abuse, including alcohol and drugs, can weaken the body's defenses against TB. Living conditions. Overcrowded and unsanitary living conditions, as well as incarceration and homelessness, are associated with higher rates of TB transmission. 4. Tuberculosis symptoms. The symptoms of tuberculosis can vary depending on the affected area of the body. Pulmonary TB, which affects the lungs, is the most common form. Common symptoms of pulmonary TB. Persistent cough. A cough lasting more than 3 weeks, which may produce sputum and sometimes blood. Chest pain. Discomfort or pain in the chest, especially when breathing deeply or coughing. Fatigue and weakness. A general feeling of tiredness and reduced energy levels. Fever and night sweats. Low-grade fevers, particularly in the evening, and night sweats that can drench clothing and bedding. Weight loss and loss of appetite. Unintended weight loss and a decreased desire to eat. Extrapulmonary TB symptoms. Lymph nodes. Swollen lymph nodes, particularly in the neck. Bones and joints. Pain and swelling in the affected bones or joints. Kidneys. Blood in the urine and pain in the back or side. Meningitis. Headache, fever, and neurological symptoms if TB spreads to the brain. 5. Mycobacterium tuberculosis. Mycobacterium tuberculosis is the bacterium responsible for causing tuberculosis. It is a slow-growing, acid-fast bacillus that is highly adaptable and capable of evading the immune system. Characteristics. Acid-fast bacillus M. Tuberculosis retains certain dyes after being washed with acid, a characteristic used in diagnostic staining techniques. Slow growth. The bacterium has a slow replication cycle, taking 15 to 20 hours to divide, which contributes to the prolonged treatment duration required to eradicate the infection. Cell wall. The complex cell wall of M. tuberculosis contains mycolic acids, making it resistant to many common antibiotics and contributing to its ability to survive within host cells. 6. What is tuberculosis? Tuberculosis, TB, is a contagious bacterial infection caused by Mycobacterium tuberculosis. It primarily affects the lungs but can spread to other parts of the body. TB is one of the top 10 causes of death worldwide and poses a significant public health challenge, particularly in developing countries. Conclusion. Tuberculosis is a complex and serious infectious disease that requires comprehensive approaches for treatment, prevention, and management. Understanding the causes, symptoms, and transmission of TB, along with advancements in diagnostic techniques and the importance of public health measures, is crucial in the global fight against this ancient yet persistent disease. Efforts to improve vaccination, adherence to treatment protocols, and public awareness can significantly reduce the burden of TB worldwide.